Guys, here we are in IU medical lecture. Today my topic is sulfonylurea. Before starting this, if you haven't subscribed my lecture, then do subscribe for more videos. Okay guys, now sulfonylurea. Sulfonylurea, we know that it is used in type 2 diabetes mellitus. We also know that it requires beta cell for its function, so it cannot be used in type 1 diabetes mellitus. We also know that it has two generations, first generation and the second generation. In the first generation we have chlorpromide and tolbutamide. See the word MID. It is an indication that it is first generation sulfonylurea. Second generation, we know that we have glyburide and glypazide. Third one is glyburide, but some says it is third generation. Why? Because glyburide has different protein bonding other than sulfonylurea. What is we know about the glyburide? We know that it is safe in pregnancy. What are the drug we can give in the pregnancy? We can give metformin, but still the research is going on with these drugs. We also know that we keep this drug orally. It is well absorbed and it binds to the albumin. And we also know that our second generation is more potent than the first generation. So guys, what sulfonylurea do with our body? Let's look its mechanism of action. Suppose it is our beta cell, and here is potassium channel, here is calcium channel, here is a receptor for sulfonylurea, and here is our insulin which is not releasing, and there is a continuous efflux of potassium. So what happened? We give our drug sulfonylurea. This drug comes and bind to its receptor and block the potassium channel. So sulfonylurea comes and inhibit this potassium channel. Then potassium will not leak outside and potassium remains inside. So inside become the more positive. Means suppose if it is minus 95, so it becomes minus 75. It reaches the level of threshold and the depolarization will occur. Then the influx of the calcium will be there and calcium binds to the vesicle. Then our vesicle fuses and our insulin is released into the blood. So insulin comes out from the vesicle and our blood glucose will be lower down In this way our target is achieved. So this is a simple mechanism of the sulfonylurea. Okay guys, we have learned the mechanism. Now what adverse reaction that this drug will cause? We know that our first generation causes disulfiram like reaction. We know that the disulfiram reaction in this patient present with nausea, vomiting, headache, hypotension, etc. And our first generation will cause severely hypoglycemia, and also our sulfonylurea causes weight gain. And we should be cautiously, here is our precaution, that we should not use this drug in hepatic or renal dysfunction. Thank you guys. Herewith we are done with sulfonylurea, and it is a simple drug. I hope you learned, and if you like, then do comment. Thank you.